Well, hello there. This is Mark Ittleman, Speech Language Pathologist, and welcome to the teaching of talking. You know, these videos have been a lot of fun to do because I've been sharing very important principles with my audience, with the people who like the teaching of talking. So, the first thing I want to do is I want to applaud you for taking the time to listening to these videos, and to applaud you also for just taking an interest, whether you're a caregiver, whether you're a person with aphasia, or whether or not you're a wife or a therapist. It really makes no difference. The wonderful thing is that you are interested. Now, today I want to talk to you about a very important concept in speech therapy, and it is a concept that every speech therapist or every speech language pathologist works towards. And what that is a term that we call carryover. So you might say, well, Mark, what do you mean carryover? Well, carryover means that you've learned something. Okay, so if I teach you how to do X and you're not really getting it, and I continue to stimulate you so that you can learn it, then one day you wake up and you've got it. Okay, and that's called carryover. When you have learned something, and you can automatically do it. Now, we've all had experience with carryover. One of my first big experiences with carryover was learning to count to 100 when I was in grade school. I thought, man, that was going to be something tough. That was really going to be hard. But it really wasn't with time, because you repeat it, and within a period of time, you can then do it automatically. You can count to 100. In fact, you can even count backwards from 100 down to 0, because of the fact that you did it time after time after time after time after time, and it became automatic. So counting to 100, you then develop carryover when you can do it automatically. Okay, so it's not really a complex idea. One of the next difficult things for me was learning the times tables. And gosh, I never thought it would take me that long to learn the times tables. And then when we got to chemistry, I had to learn the periodic tables and all of that kind of stuff. And I just thought in the very beginning that, man, this thing is going to be impossible. I don't think I'm going to be able to do it. And things like that. But with time and with repetition, I was able to get carryover. And as I'm talking to you about this, you could probably think of various situations, maybe learning to drive a stick shift, and how in the beginning you were grinding the heck out of the gears in the transmission, and your mother or your father or boyfriend would cringe their faces every time you'd grind through the gears. But with time, you learned how to shift those gears, and before you knew it, you could do it automatically while you were looking out the window, while you were talking to your girlfriend or talking to your boyfriend. I mean, so it just became automatic. So carryover is the automaticity of something that you're working on. Now, when it comes to aphasia, carryover is when the individual with whom you're working, and if you're working on vocabulary, and if you're working on simple nouns and simple phrases like coffee or drink coffee or go bathroom or eat meatloaf, or walk outside, or ride in the car. You see, all of those are a set word that also you add a word or two to it when you know that it's the right time. And so the thing that the speech pathologist is constantly aware of is whether or not that person is carrying over. Are they beginning to say the words by themselves? Is the person saying the word by himself or herself? Is it starting to pop up around the house? And frequently I'll work with a couple, and I'll get on the phone to do the speech and language stimulation, as in the teaching of talking 2.0. And the spouse might say to me, Mark, you should see, my husband said socks today, or he said put on socks, and he said it all by himself without having to ask him, without having to repeat him, or he said ice cream, or any other number of words. Okay, so that's carryover. And when you start seeing carryover as a result of speech and language stimulation, as you start to see and hear the person with aphasia starting to say words spontaneously, especially the words that you've been working on, but it doesn't always mean that, because sometimes we work on a bunch of words, and what that does is it triggers other words, which is amazing. Now, I want to tell you about two kinds of patients that we see. We see one who we start seeing carryover pretty soon after the therapy process starts. And that's wonderful. And then, I have to be perfectly transparent here. There are some who we work with, and we'll work on the same words, we'll work on different phrases, we'll go back to those words, we'll add new words, we'll go back to the old words, we'll add new ones, we'll do different kinds of activities that are fun, where they're saying the important words they need to say, because these are all very important words that they use around the house. But there are some who sometimes I just have to scratch the back of my head and go, when the heck are they going to start saying these words automatically? And a lot of caregivers start doing the same thing. They say, hey, Mark, we've been working we've been working for a while with you, and some of the words are coming, but how can we speed this process up? All right. So the catch answer that I frequently give is that carryover of speech as to when is it going to happen? That question is sort of like the question you ask yourself when you come down with a flu, or you come down with a sore throat, or you come down with the measles or the mumps, or you come down with some kind of problem. The one thing you have in your mind is, when am I going to get over this? But you know something? You have no choice. There's nothing that you can do other than continue stimulating the words and saying them over and over and over again. Okay? That's what you must do. You must not think about when is the carryover going to occur, because it almost always does. But you know something? Sometimes it takes its own sweet old time. Okay? And so you just have to be patient. Now, some people go, well, I think I might decrease his therapy a little bit because, I know he's doing well. And the carryover isn't really coming along quite as good as I think it should. So maybe we ought to just cut it down a little bit. But the answer to that is, please don't. You know, the human brain, especially when you're dealing with a brain that's been injured, especially a part of the brain that's responsible for speech, when that part of the brain gets hit, as in a stroke or as in a clot or in a hemorrhage or any of these number of things, what happens is that blood flow to that portion in the brain gets interrupted. And when blood flow with oxygen and nutrients is supposed to go to a certain portion of the brain, then if that's blocked, then that portion of the brain gets weak, and that portion of the brain may become inactive because it's not getting blood flow, it's not getting oxygen, it's not getting nutrients. And so that's what happens in some cases of a stroke. But then there are other areas that are nearby that take up the job of the speech center. But you know something? It's not always as good. In fact, it isn't as good. It's not as efficient. It's not as nimble. It's not as good as the original part that is responsible for speech. So that part takes a while longer to get conditioned. So that's what you're dealing with. Carryover. And my suggestion is that the intensity of therapy, the intensity of speech and language stimulation, how often you stimulate words, how often you stimulate a phrase, or how often you stimulate anything that is correct for that individual, because everybody's different and everybody has different goals. Nobody has the same goals. Okay? So you have to keep working at it and plugging at it, and you have to vary up the methods. You have to use different methods. You have to try different stimuli. And if you just continue to keep doing that and keep going and be persistent and don't give up and just stay focused, then what happens, almost as if by a miracle, is that persistence happens to be, I think, something that's rather magical. I can't tell you how many times in my clinical background I may have worked with a patient and decided to discontinue that patient, and one of my colleagues picked up that patient, and I said to that colleague, don't waste your time with that person. I worked with that person for blah, 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 for months and months and months, and didn't get much carryover. But I remember a couple of different cases, one or two cases, where there was a speech pathologist by the name of Ellen in Winter Haven, Florida, who would take these patients, and she wouldn't give up on them. She wouldn't give up on them. And what happened was, months later, they were doing a lot better. So that example taught me not to give up, but to continue and persist. And if anything, don't decrease, but increase. This is Mark Ittleman, who's been talking about carryover. And I hope you've enjoyed this little lesson, because it's a lesson that you'll learn if you're dealing with aphasia. Believe me, you'll know all about carryover, and you'll be dealing with carryover because it's something that is a part of the work. And I want you all to be a part of the work and learn how to stimulate speech and language, whether you're a caregiver or a wife or a family member or a therapist. So I'm going to say goodbye at this point. But underneath this video is a link, and the link is to our website at teachingoftalking.com. Please come visit us there. We've got a new website at teachingoftalking.com. Come around, visit with us, and please sign up for the blog and the video, and also click on the questionnaire survey so that if you'd like some mentoring or if you'd like some help in working with your loved one, just fill out that questionnaire and send it to me, and I'll get back with you before you could say Jack Sprat could eat no fat. Okay? So, y'all have a great day. And remember what I said about carryover. It's a very important part of the work. Bye-bye now.